Cool.
Okay, so we've just got a picture there of everyone that's in the room. Just one person stepped out for a moment. And this is going to be for my unit LLN, which is the 15-minute presentation which needs to go with the rest of the unit, which I'm putting through HBA. Okay, so we'll get started quickly so everyone's in and out. Just to give you an example of what's going on, this is a unit of competency infection control presentation as part of a qualification that is needed for your Certificate 3 in Health Administration. Now, all learners are of a level 1 to 2, so this is going to be a basic presentation made to the people that are in the room. So just to start off with, what we'll be assessing today is the types of waste, personal protective equipment or PPE, and hand hygiene. Now, just to let you all know, at the end of this presentation there will be a requirement to complete a questionnaire which will also assist me in assessing your competency within the unit. So it'll be based on your interaction with me within this presentation, as well as this questionnaire at the end, which is a 9-question based on everything that you're seeing here, and you will be able to use your books to refer across to answers to those questions. Okay? Any questions so far? No? Okay, now types of waste in the workplace, specifically within health. We basically have clinical waste, which is classed as a hazardous waste, cytotoxic waste, which is also classed as a hazardous waste, general waste, sharps waste, recyclable waste, organic waste and liquid waste. Your liquid waste and your organic waste you'd mainly find down in your areas like your kitchens where they're making the food and things like that, and also your cafeterias. The main ones we'd see in ED, which is what I'm basing this competency on, would be your clinical waste, your cytotoxic waste, your general waste, your sharp waste and your recyclable waste. Okay? Kara's just re-entered the room. Now, your colours of your waste bins, bags used, below is a list of what they actually are, and I've actually brought a couple in so you can have a look at what they look like. The first one we've got here is clinical waste, and that's in a vivid yellow. So things like blood and body fluids are used to be disposed of with these. So you've got your clinical waste bin here. They can either be in this form or the form of an actual SULO bin, which is yellow. And then they've also got what you can and what you can't actually put on to those bins. So that's your clinical waste vivid yellow. Then you've got your cytotoxic waste, which is your purple. Now these are some antibiotics, toxic PPE, toxic syringes and toxic vials. Basically they're in the purple, and they can either be in a SULO bin type like this one, or also for your sharps in the purple sharps bin. Okay. Does anyone have any questions so far? No? Okay. Now your next one, and the one that we probably use more than anything else, not only within work but we also use it at home, is your general waste. Now your general waste is usually in either a translucent, opaque or white. So that's an example of one. And as you can see, you've got your opaque bin or your bag that it goes into. Now that can be a range of things. It can be bread, food waste, solid cleaning products. It's basically what you use when you throw things out at home. So that's the easiest way to remember what your general waste is. Now the reason why I put that green bin in there is you'll see that in all of the waste disposal areas, the main where we put all of our waste, that green bin is the one that they put the bags into once they've been filled. Okay, as you can see, one's sitting out at the end there. Now, the next one is your sharps, which is a yellow bin as well. I couldn't actually get one of those to show you because it is a different colour yellow to the clinical waste. It's a brighter yellow. Even though that's classed as a vivid yellow, I would actually say that your yellow bin for your sharps and things like that is actually brighter. And that's where you put your needles, and also scalpels and things like that, but in the ED it'd be mainly needles or anything that's used that's had blood products put into it and things like that. And then the final one that we've used down here is your recyclable waste, which is a blue bin, which is once again like a Sulo bin type, or a cardboard one labelled with, you know, paper recycling, which is usually made of either paper or cardboard, obviously. And then you put any paper product or cardboard product in it. Once again, it's the same as what you'd use at home. Okay, so that basically finishes off that unit. The next one we're going to go across to is personal protective equipment, which is PPE, which in the ED is used quite regularly. It's used when there's a potential for exposure to blood or body substances. So it's protecting you if you're basically doing anything that's going to put you in the line where you're looking at getting blood or body substances on you. Okay. Now what I've done is I've gone through now, and this will be a very quick showing of what we class as PPE equipment. Now the first thing that we've got here is gloves, and they're basically worn as a barrier to protect the wearer's hands from contamination. Now there's a couple of versions of gloves. Probably the ones that you see most often are these ones. So they're basically just put on like you would any normal glove, and make sure that you get it that it's fitting your hand quite tightly. So as you can see, that one's probably a bit big for me. That's a large, so it's a good idea to see what size you are. And another one that we use is a DermaShield one. Like if you're actually allergic to latex, there's also one that's not latex based. And then another one that we use, which is mainly procedure, is Nutlex, which are individually wrapped, and they're sterile. And that's what they basically look like. Okay. Now the next one I've got are masks. Now this is to protect the nose and the mouth from infectious agents that may come through. Now there's a variance of masks depending upon what you're using. If you think it's something that's going to splash, you want to have your eyes covered as well. So you've got just your basic mask, which is that one there, which you bring out and you fit to your nose like that, and you actually tie it around the back. So that's just protecting your mouth and nose area. And then you have one that's an actual shield, so that's also protecting your eyes. And once again, it goes on the same way where you're tying up, so you're protecting your mouth, nose, and also your eyes. Okay. Now, the next one that we've got are protective eyewear. Now, there's a couple of types that we use here. I've brought one of them with me today. And once again, this is basically protecting you from a splash injury in the eye area. So you've got these ones that are basically like glasses, but they loop around the side, so they're protecting the side of your face as well. And then once again, you've got these as well, which you can see, they go around the side, so they're protecting the side, and they're basically enclosing your whole eye area, like that. Okay. Okay, the next one is gowns and aprons. Once again, it's protecting your clothing, and also with this yellow one here, which I've got an example of, protecting your arms as well. So once again, it's from exposure to blood or body substances. And that basically you just fit like so. And then you tie it at the back. Okay. Now, the sequence of donning and removing PPE. There's a way that you need to put it on and a way that you need to take it off, so that you're protecting yourself more so when you're removing it. So you're basically doing your hand hygiene. I'm going to go through in the last piece of the actual presentation. So you perform your hand hygiene, you put your gown or your apron on, then your mask, your protective eyewear visor, and then your gloves. So in reverse, basically taking everything off, it'll be gloves first, then you do your hand hygiene, your protective eyewear or a visor, your gown, apron, and then your mask. Okay. Now these handouts that I've given you there, you can keep those as a reference as well. So if you ever want to look back in the future once you've started working in the department, you can actually use those as a bit of a reference. and it's also on the intranet underneath CEWD, which is the training units that they use. Now, the next one I'm going to do is hand hygiene. And I think that was, I found this statement on the intranet for Sydney Local, and I think it's quite good that it explains that hand hygiene is the single most important strategy to preventing healthcare associated to infections. Now, we do it in our home life as well, or I hope we would, to stop infection, but it does help. I think that's a pretty good statement that's been made there, is how important it is to have hand hygiene within a health and hospital environment. Okay, hand hygiene is a general term referring to any action of hand cleansing. It includes washing hands with the use of water and soap, or a soap solution, or applying a waterless hand rub to the surface of the hands, which is basically your alcohol-based hand rubs. Most of the ones that you'll see around are of that format, which is the Cutane, and then you'll also see them at most points as the pump pressure packs as well, sanitisers. So they're the two options that you get. Now, the 5 moments of hand hygiene. You must perform hand hygiene at 1, before touching a patient, 2, before a procedure, 3, after a procedure or body fluid exposure risk, 4, after touching a patient, and most importantly 5, after touching a patient's surroundings. So they're the areas that they expect you to actually do your hand hygiene. Depending upon your role within the ED, most of you are clerical, so a lot of it would just basically be when you've been in the bathroom and things like that, but nursing and medical staff, they need to follow that procedure quite closely to stop infection. Okay. Now, the type of hand hygiene to use. You've got alcohol-based hand rubs, which is in a clinical situation where you're visibly clean, so like I am here now. And once again, there's an example there of the Cutane and also the wall sanitisers that you can actually use. Now, this is a hand rub, how you actually do it. Now, I know that's a very poor print of it, but basically you can find this on the intranet, and also it's basically you're just rubbing your hands together and making sure that the points are actually touched with the actual Cutane. But that's more for you to keep as an after as to how it all works and what's expected. So that's for your hand rub. Now the next one is wash with soap and water. Now we all do that. We do it at home, we do it out when we're out, things like that as well. So basically you wash with you wash with soap and water when it's your hands are visibly dirty, they're visibly soiled with either blood or body fluids. You've had an exposure to a potential organism that is strongly suspected that you could get a disease from, and then basically after using the bathroom, that's pretty standard. So you've got all of the bathrooms within the hospital basically look like that. They have the microshield as your soap and then your paper towel, thank you, to help you with that. And then once again, there's just a handout there of how to actually clean your hands and what's expected when you're cleaning them. Okay. Now, that concludes my presentation. Has anyone got any questions at all before we go through to the next stage? No? No questions? Okay. Now what we'll do now is we'll actually complete the questionnaire. The questionnaire is actually based on the presentation. You may use your handout to answer these questions. And once again, I'd like to thank you for your time today. I do appreciate it. It's difficult when I work in a situation where I don't normally do this. And I do really appreciate you all attending today and helping me out with finalising this course, okay? So that's it. I'll get you to stop it, Jace. Yep.